Now that the holidays are over, many of us are looking for simple and effective ways to improve our health in the new year. One way you can do that is with a detox to start the new year. Our bodies are exposed to toxins like alcohol, heavy metals, and microplastics. As a result, we experience brain fog, low energy levels, and mood swings, among other things. We've created a product to help naturally detoxify your body called Defender Detox. And for a limited time, we are offering 50% off with discount code NEWU50 at checkout. Don't miss out on this simple way to elevate your health in 2025. Visit centurionlabs.com to order Defender Detox today. Today on the Frontline Health Podcast,
is I really think there's an almost inherent distrust of the medical community right now. And we're seeing things where they talked about one thing and then they did something else, or you had some of the professionals say, hey, you should wear 2 masks, and then you'd see them not wear a mask off camera, and it was almost a charade of sorts when it came to the medical community. And unfortunately, I think that has done a huge disservice to the population as a whole, because now we're confused. We don't know who we're to trust, who we're to go to, and it becomes a lot harder to kind of wade through those waters of whooping cough or bird flu or whatever it may be. Because
hello and welcome back to a brand new year on the Frontline Health Podcast by Centurion. My name is Evan Patrick, and with me is our founder and CEO, Troy Dull. Troy, Happy New Year.
Happy New Year to you. Excited to be here. How about you?
I'm very excited for our first episode of the new year because it is another episode of our health headline highlights, and those are always very interesting.
Yes, they are, and there are some good ones that are out there this year. As we wrapped up last year, one of the ones that popped out to me was repeated acetaminophen use may not be as safe as previously thought. And I thought it was interesting because it was a study out of the United Kingdom, and basically they looked at 180,000 people. So it wasn't a small study, and they were 65 plus. And these people used acetaminophen, which is the same thing as Tylenol, at about 12 prescriptions in 6 months. And they compared the outcomes with another 402,000 people. And they identified an increased risk in those patients of heart failure, chronic kidney disease, hypertension, and peptic ulcers, which was pretty interesting to me because we've always heard that Tylenol, acetaminophen, is super safe. And this kind of goes against that narrative that we've always heard out there.
So I know people have a lot of different responses when they are sick. You have some people who are very quick to medicate. They want to go to the store and buy a product that's going to help them feel better or get better quicker. Mm-hmm. And then you have other people who are so averse to taking any type of medication that would help that even when there are things out there that can help, they might be averse to doing that because of potential side effects or whatever the reasons are. I know one of the old wives' tales that I have heard when it comes to people running fevers, which of course acetaminophen is supposed to help reduce fever, is that a low-grade fever is actually a good thing, and it's your body's one of your body's natural defense mechanisms to help defeat the virus and rid your body of that virus as quickly as possible. And I'm wondering, is there something to this? Should more people consider just letting a fever run its course before taking something like acetaminophen to help with the fever? Or are these products still a good idea to help when we're sick?
Yeah, it's a great question. I think it still has a place. And really where most of this study is talking about is chronic use of acetaminophen. So when somebody has joint pain or arthritis or something along those lines, that's where they're seeing the biggest issue with it. So they don't see as much issue with that short-term use that you're talking about, which is fever. So in this case, if you're using it for fever, use the lowest amount possible and for the least amount of time possible, and you should get the effects you want, because it is an ongoing debate whether to let those low-grade fevers roll or to go ahead and take something. I think a lot of it depends on your situation and personal scenario or kid's scenario. So if that fever starts to get about 100, you really need to be taking something to help reduce that fever so you don't have other issues long term with it. So that's usually where I cut the difference. Mm-hmm. And most people are feeling okay and they can function when it's below 100, but once it gets to about the 100 or the high 99 range, then that's when people start to have an issue and can't really function the way they normally do.
So you've mentioned Tylenol as, basically being the same thing as acetaminophen. That's the most popular brand that we would recognize when we go to the store to get acetaminophen. Mm-hmm. Are there any other products out there that people need to know that acetaminophen is in them? Because they might just know, I take this medication when I have a fever, but what other products are out there that contain acetaminophen?
Yeah, there are some sleep aids that have a lot of acetaminophen in there. So like Tylenol PM, some Benadryl PMs will have it in there, or Benadryl. So you have other pain relievers. You have cough medicines that have acetaminophen in there. And when you take it, you've got to be very, very careful and cognizant, because we know that if somebody is a drinker, where acetaminophen gets metabolized in the body is the liver. So that seems to have the biggest effect on the liver of the medications we have. So that's why you want to use a little bit of caution. Definitely read your labels, see if it says acetaminophen or Tylenol, and then be careful.
So you've mentioned the concern for older people for the long-term repeated use of acetaminophen. Are older people the only people who need to think about the prolonged use of acetaminophen? I know you mentioned also drinkers. Are there any other categories of people, or should everyone just be aware of this?
Everybody really should be aware, because there is an upper limit of acetaminophen that you should take in a day, which is about 3,000 milligrams a day. If you take more than that, you could cause damage to your liver. And acetaminophen is one of those that can be incredibly, painful to your liver or cause big issues. So you want to really steer clear of taking too much, and take it just in little bits and pieces. Get the effect you need, but don't go overboard with it. So acetaminophen is definitely one where less is more, and you don't want to take more just to kind of get the effects.
Those are all great things to keep in mind. Thank you for that, Troy. Moving along to our next health headline highlight for today. And this is one that, to be honest, I kind of rolled my eyes at a little bit, being a former teacher and just going off of my experiences of what I saw in the public education system. This next headline reads, most U.S. teens are abstaining from drinking, smoking, and marijuana. This last part, very key, survey says. Teen use drug trends. So what we're seeing is that 2/3 of 12th graders abstained from alcohol, marijuana, cigarettes, and e-cigarettes. That's the one that I particularly question.
Yeah, I agree.
In the past 30 days, and that's the highest since 2017. So we're seeing these trends. It looks as if the use of these substances has declined in teens really since the pandemic, specifically. Mm-hmm. And people have tried to come up with different explanations for this. Maybe it's because there wasn't quite as much peer pressure to do this or availability as kids were apart during the COVID-19 pandemic. There are all kind of other reasons that this could be happening. Or maybe if you're like me and a little bit cynical, you just think it's because maybe these teens aren't being totally honest in this survey.
That's true. And I think you have to ask that question, how much merit is really to this survey? I mean, we can all say anything we want to, and teens typically will say whatever in order to try to keep themselves from getting into trouble. And this is one of those that they may think, if I answer it a wrong way, I might get in trouble, even though it's totally anonymous.
That's right. So we take this with a grain of salt. We can't really know that these surveys are 100% accurate, but hopefully this is a good sign, and it means that kids are being more aware that there's a lot of danger that comes along with these substances, especially as we see a lot of these drugs that are out there containing substances that are not, that they don't even realize are in it, that can be especially harmful and addictive.
Yeah, I mean, I'm hopeful that maybe some of the news about laced fentanyl or laced marijuana or marijuana laced with fentanyl, some of that news is getting out there. It's creating a greater fear and a worry of, hey, if I take this, there's a good possibility that I die, or I'm basically playing Russian roulette with the drugs that I take. So hopefully some of that news is getting out there and people are becoming more aware, but it's still a survey of teens and who knows what's going on, really.
That's right.
Could be a good sign, though. Our third headline, it says the CDC confirms the first severe U.S. case of bird flu in Louisiana. So I know that earlier this year we talked about some of the bird flu cases that began to pop up in Michigan and Washington State. Well, here's the first one in the southeast in Louisiana, and this was in the middle of December. And it says that this is the first ever confirmed case in the U.S. in southwestern Louisiana. They were exposed to sick and or dead birds in a backyard flock, and that led the CDC to start ramping up its concerns and feel like that, there are certainly things we want to be cautious with as we're dealing with birds, but from what I'm seeing, it doesn't seem to be a huge risk as long as you treat people and you don't just leave things untreated like we did during the COVID pandemic.
Mm-hmm. So maybe I'm just ignorant, but I'm wondering, when I hear things about the bird flu, is this transmissible to humans? Is that why there's so much concern about it? Is it just because we shouldn't consume poultry products that are affected? Why should we even be concerned about bird flu?
Well, bird flu is one of those things that they have seen wipe out flocks of birds. Then they have seen it jump to cats or to cows. So their concern was, if it jumped from cows to humans or from the birds to humans, that this particular virus is so lethal when it's dealing with birds or cats that same lethality would happen in humans. There are plenty of diseases and viral infections out there that affect the animal kingdom that don't affect humans. So I don't know if some of this is certainly merited, or if it's a continued increase in fear to make us worried or go out and get some things that maybe we don't need to get.
Mm-hmm. Our next headline is on a similar note. California Governor Newsom declares state of emergency over bird flu. So we know California has been watching this for a while. They had cases that were reported before Louisiana, as you just mentioned. So we see this that California has decided even to declare a state of emergency over this.
Yeah, crazy. Why? I mean, what do you think the rationale is for declaring a state of emergency over something that hasn't even really created? As far as I'm aware, there has not been a death in a human associated with bird flu.
Yeah, I think that's something that only our listeners can answer for themselves, why they think that Governor Newsom would make this decision to declare a state of emergency, whether there actually is a risk or whether there's not. But one of the things that we do know is that there's a lot of fear in the population all across the United States of viruses and of pandemics. Mm-hmm. We experienced this with the COVID-19 pandemic. People have a wide variety of opinions about whether the lockdowns were effective, whether it was all hysteria and none of it was really effective. We see the repercussions, speaking of teens earlier, the mental health issues that it caused with them, not just teens, but really everyone, as we took away a lot of social elements of our society. And there are a lot of people who I think really haven't come out of the fear from the COVID-19 pandemic. And so I think maybe in certain parts of the country, people are more likely to have this kind of fear-based reaction, and possibly Governor Newsom is making this decision based out of fear rather than off the science and what we're actually seeing.
Yeah, I think one thing we have to step back and really look at is understand that a viral infection is the same no matter what. So from that standpoint, there are certain things we can do to prepare ourselves and do the best we can. So if we're in the best health possible, we're exercising, we're eating right, we're taking supplements or whatever it is to help us get that health level we need, then we prepare our bodies to handle a viral infection, and we will fare much better if we're in good health than if we've had high blood pressure, diabetes,
That's right.
If we're overweight. So work to get our bodies in shape and take ownership of our health, like we always say here.
Absolutely.
And our final headline, CDC warns whooping cough cases are 6 times higher than a year ago. The United States is beginning to return to pre-pandemic patterns where more than 10,000 cases are typically reported each year, the CDC said. So in 2024, according to this article, it said we had over 32,000 cases of whooping cough, whereas in 2023 we had about 51 cases during that same period. And what their concern is this starting to increase beyond the level that we had pre-pandemic and something we need to worry about? Or is this something that is just us getting back into the normal routine of things? And I think a lot of this is really us getting back to those pre-pandemic levels, because a lot of the things we did with whooping cough in particular, it helped kind of take that down, because whooping cough, you do have to have a big community around you. That's how it spread. So when you had social distancing, when you wear masks, it keeps those droplets from being spit out of people. So it's not that the mask would keep you from getting it, but it keeps you from spreading it. And that's the number one thing that I think happened and why we're seeing an increase with that.
Yeah, it's fascinating how we keep going back to COVID-19 as kind of a marker for a lot of transitions in health and opinions, one way or the other, in practices, one way or the other, and even in viruses that we see popping up. A couple of months ago, you actually mentioned on the podcast that there was a high school football game canceled in one area due to increased whooping cough cases in that area. So this is something we've continued to monitor. And I'm wondering, are less people getting their children vaccinated? And if so, why do you think more parents are making that decision? Is that related to the COVID-19 pandemic? Or is it related to factors like what you just mentioned, people not being around each other and building immunity?
Yeah, I think it really has more to do with the measures that were taken during the pandemic, with social distancing, with the masking. So that kept people from spreading it. But I think some of the vaccination piece, the reason we're seeing fewer people get vaccinated is I really think there's an almost inherent distrust of the medical community right now. And we're seeing things where they talked about one thing and then they did something else, or you had some of the professionals say, hey, you should wear 2 masks, and then you'd see them not wear a mask off camera. And it was almost a charade of sorts when it came to the medical community. And unfortunately, I think that has done a huge disservice to the population as a whole, because now we're confused. We don't know who we're to trust, who we're to go to, and it becomes a lot harder to kind of wade through those waters of whooping cough or bird flu or whatever it may be, because it may be one of those scenarios where they've cried wolf one too many times, and people now go, well, why are we listening to what you say? You lied about everything else during the COVID pandemic, or you were wrong about those things, so how can we trust you now? And I'm afraid that's more the case than anything else.
And I think it's important to note that there's a lot of disarray within the medical community itself.
That's right.
There were doctors who were blacklisted for having certain opinions or wanting to explore different ideas during the COVID-19 pandemic. And I think some of those doctors have continued to explore alternative types of medicine and alternative pathways and ways of treating different diseases and illnesses and various ailments. And so even within the medical community, we see that there's a lot of differing opinions now that maybe are gaining more attention that wouldn't have in the past. So that's a potential positive note from this, is that those opinions that would have at one time been considered very fringe are now gaining more attention.
I think you're absolutely right. And I think you saw even the awareness within the medical community during that time where, wow, I'm under the control. If they were a physician, a lot of times family practice, as you were growing up for years, family practice, they were their own practice. But now they're a part of a hospital or some other group that tell them how they're supposed to practice, that tell them how they're supposed to treat people. And I think if we can get back to those individual doctors being able to practice medicine instead of this herd mentality, where they're more curious and they find ways to treat things in different ways and better ways, and we really get back to this idea of how can we prevent as opposed to cure after. I think the old saying is an ounce of prevention is worth a pound of cure. I think in the health world that is certainly true and the case.
Well, thank you for sharing those insights today with us, Troy. I appreciate it as always, and it was very enlightening. And thank you for listening to this episode of the Frontline Health Podcast. As always, we encourage you to go out and take ownership of your health today, because no one cares more about your health than you do. If you enjoyed what you heard today on the podcast, please consider subscribing and leaving us a review. We would love to hear your comments or questions about anything we've talked about on the show. For more health news, tips, and insights, follow us at Centurion Labs on Facebook, Instagram, X, LinkedIn, and YouTube. And for safe, effective, and affordable healthcare products made in the USA to help you elevate your health and life, visit CenturionLabs.com. We look forward to you joining us next time on the Frontline Health Podcast by Centurion.